Yeah, super happy to be here. My name's Dylan Peterson. I'm a licensed clinical social worker. I work for Blomquist Hill. I've been here for about 2.5 years now. Um, Been great. And I'd like to just kind of take this time at the beginning to tell you guys like what it is we do, what it is we offer at Blomquist Hill. We are an, we are an employee assistance program, so we offer therapy to uh, tons of different companies. Anyone who has the Blomquist Health benefit, meaning if you are an employee with a company that has our benefit, you are eligible to get services from us. We do therapy, individual, marriage, family therapy. We also do like case management. We can help with referrals. We can help with crisis. We have a crisis line, so you can call Blomquist Health like after hours and ask to speak on-call therapist if you're in crisis, or if you just really need to talk to someone right then. Um, so those are some of the services we do. We also do presentations like this, amongst other things. We're always kind of looking at different ways to just connect with our community, our clients, and just meet the needs of our people. So, anyways, I'm guessing probably a lot of people here today probably work with one of our affiliates. And so if this is your first time kind of making contact with us, I'm just so happy you're here and it's a real pleasure. So with all that being said, I guess we can get started. Just one more time to reiterate, we'll keep the questions to the end. Please put your questions in the chat. We'll get towards them at the end. Today, I'm pleased to be presenting about something that I talk about all the time with people when they come into counseling here to do solution-focused counseling at Blomquist Health. We work on a lot of times what we call behavioral activation. And so behavioral activation is it's a treatment in and of itself. It is a cognitive behavioral therapy skill and anyways, this slideshow I titled "Behavioral Activation: Treatment of Depression," and let's get into it. So I have here this cognitive triangle. So this basically is like the main kind of I don't know. This is one of the main ideas of cognitive behavioral therapy is the cognitive triangle. This is this idea that our feelings influence our thoughts. You can see those arrows going up on the right side of that pyramid. Then going down, our thoughts influence our behaviors. Behaviors, and you see like a gear turning, right? But that's the movement. That's what we do. That tends to, go into how we're feeling and so on and so forth. And, I think this triangle works kind of nicely like that, but I think it probably works the opposite way and any which way in between as well. Um, but at the core of cognitive behavioral therapy, we just have this idea that if we can get more awareness of what our thoughts are and what behaviors are, maybe we can have more effect or control over our feelings or our affect, as sometimes it's called. So move on to this next one. So what is behavioral activation? I mean, I don't know about you guys, but as soon as we look at that triangle, you see the behavior going into the feeling thing. Maybe that's getting some wheels turning, some gears turning, but behavioral activation is a this idea that maybe what we do influences how. So it is a specific cognitive behavioral therapy skill. It is sometimes a skill that is a treatment in itself, and it's meant to be used with other cognitive behavioral therapy skills. I mentioned here cognitive restructuring, but there's a lot of other ones, maybe diffusion, cognitive diffusion, or maybe somatic sensory grounding, other skills like that as well. But it's used to help alleviate the symptoms of depression. Someone comes into counseling, and they're like, oh, I've had this low motivation. I'm just not doing things like I used to. It's hard to get out of bed and not really sleeping very good at night. Okay, it seems like maybe there's some depression going on here. Maybe we ask them a few more questions. Anyways, we try to arrive to a point of, okay, it seems like, if we arrive to a point of, okay, it seems like you're dealing with depression. Um, One of the things that you might work on with a therapist is this behavioral activation. So it is a treatment for depression. Why try it? Some little notes here. So this just helps us learn how, what we do affects the way you feel. It helps us with acquiring skills. It helps us with setting goals. Behavioral activation helps with verifying values. And it can help relieve symptoms of depression or like seasonal affective disorder. There's probably other reasons of why we might try behavioral activation, um, but these are some. Will behavioral activation be helpful? Do I have a sense of what is triggering my mood or anxiety? So I think if you're someone who has a sense of what is triggering this low mood or anxiety, perhaps VA will be helpful for you. Do you find yourself doing very little and finding little pleasure? Answer yes to that. I think it's helpful. Are there times that I feel better or worse and I'm not sure why? Do I have a difficult time working with my negative thoughts, but seem to feel better when I can get myself moving and doing something? Do I have a hard time even knowing what I enjoy or find meaning in? So if you can answer yes to any of them, I think that most likely this behavioral activation can. So, so what is this based in? So basically, it's based in a well-researched understanding that, depression, it's not just what it does to us, but it's what it we have loss in functioning, right? It's harder to enjoy those things we normally enjoy. I mean, that's probably the worst part of depression is this anhedonia, lack of pleasure. We can with a lot in life, but if we're not feeling very happy, fundamentally, right, it's easy to why people struggle so you're not even feeling pleasure, and at that point, you have to hang your out, right? Um, and that's exactly what behavioral activation wants to help with. We want to say, no, we're going to find ways to find meaning, pleasure, in life again. And that's one of the things that I love about it. Um, so it's also based in this idea of a downward spiral. Uh, Depression tends to have this downward spiral, and we're trying to reverse that spiral and go up. But that downward spiral is typically characterized by vicious cycles of like, don't feel like getting out of bed. I'm having these negative thoughts, and I stay in bed all day, but then I don't go do things in life, and I feel sad. I keep avoiding going out and living life. I feel more sad, right? We get this negative spiral. And we're trying to get out of that and create a positive upward spiral to feeling a little bit better. And that's where we're going to start looking at, little by little, making small changes to start. So, what does behavioral activation involve? So, behavioral activation, it's really about, again, understanding those vicious cycles of depression. Um, and you'd have to meet probably with a counselor. You'd have to do some inventory and kind of look at. I'll try to speak up. I'm seeing your guys' notes here. Let me project my voice a little bit more. So behavioral activation involves understanding our vicious cycle. You'd have to work with a counselor on that. We're going to identify what those cycles are. Monitoring your daily activities and getting like an inventory where you can say, these are my up activities. These are things that generally do give me pleasure, so on and so forth. And these are things that tend to be depressing or downer activities. Identifying and clarifying goals and values. So real behavioral activation, hopefully you will spend some time with the counselor identifying specific, measurable, achievable, recordable goals, right? SMART goals. And you'll identify and clarify your values, right? And your values with a purpose of saying, I'm going to live in these values. I'm going to do behaviors that line up with these values more on a daily basis. And this is going to help with building that upward spiral of motivation, energy through pleasure and mastery. So one other thing, obviously, with behavioral activation, we're going to be scheduling activities. We're going to purposefully be scheduling in enjoyable and meaningful activities, and that will directly address the tendency to avoid and isolate that so often start to have a tendency to isolate themselves and to avoid doing the very things that tend to give them a sense of well-being in their life. And then behavioral activation also involves problem solving around potential barriers to activity. That's just another one of those things you would work out with. It's also going to help with reducing avoidance, working as a team to make gradual, systemic, sustained progress, and then using kind of between session assignments where the therapist can say, hey, I want to give you this assignment. It's not just to, give you busy work, but I want to make sure that between sessions, you're doing you're walking the walk, right? We're going to talk the talk here, and the counselor is going to listen. We want to know what your concerns are. We want to know where you're at emotionally. We want to be that safe person for you. But in between sessions, we want to make sure that we're implementing what it is that we're working on in session to hopefully make sustainable, meaningful changes. I put this slide here. Something I tend to hear, but my depression is situational. Yes, absolutely. That is very true. A lot of times depression is just situational. What did I put here? Yeah, job loss, moving across the country, moving across town, losing a loved one, just these major life changes. Not even just like losing a job, but getting a new job, right? Even things you would think wouldn't make someone depressed might make someone depressed. I mean, I've talked to people graduating college made them depressed, right? Because they had this sense of, oh, I'm a student, right? I have all my friends, I have all my professors. All of a sudden they graduate and it's like they're floating in the middle of the ocean, right? And it's time to move on to the next thing, right? And they have a lot to do there. So just to iterate, there's all these different situations that can cause depression, and they're not always exactly what you may think. And so it is important to address external things that are causing depression. But I think, and this is one of the things I like about behavioral activation, is it's about addressing the current situation, but being proactive moving forward rather than being stuck in the past. And I think that this helps us be in a more resilient mindset and to shift from being in a more resilient mindset instead of a more vulnerable. And so I think it's very strengths based and proactive. And, you know, I like that. I hope you'll like that too. So action precedes emotion. Um, so often we're sitting around waiting to feel motivated before we go do something. I think most of us know that, you can wait and wait and wait, but sometimes you just got to get up and start somewhere, right? And so that's exactly what this is about. And one of the main symptoms of depression is people feel low motivation, right? And that can be very frustrating to deal with. And even if you're not the person directly dealing with it, right? Maybe you've had a family member who's going through this, right? And just go do the things you love, and they're just like, I want to do it. It can be frustrating for you being the support person. It's frustrating for everyone, right? When we're feeling this low motivation. Um, but we're trying to address this by accumulating some positive experiences, taking small steps, going with a therapist, doing the things, gaining the skills, accumulating positives, experiencing some pleasure, making smart goals and living in values, right? And hopefully and this is over, several sessions. This is not come in one session, like you get a pep talk, you're fine. No, no, no. This is like we're going to slowly work on this. We're going to set some goals. Then we're going to have a session where we clarify values. We might do different assignments to do that. I'll actually show one later in the slide, a prompt, right, for kind of exploring your values. So you're going to explore those values. You're going to explore what goals you might have. We're going to say, what are some things you've been wanting to do, but you just haven't been able to do it for whatever reason, and we're going to try to live that life. And, one of the things, and this is actually, there's a type of therapy called DBT. So DBT is a type of CBT. Don't get too confused with. It's just a type of CBT, but they actually say that the goal of that therapy is to build a life worth living. And many people who go to that therapy are experiencing a lot of distress, right? Have a lot of traumas. They have a lot of deep emotional things going on. And that the goal of that therapy that they're going to is, hey, we're going to help build you a life worth living. And sometimes that's a very hopeful thing. I mean, if you're watching this PowerPoint and you're feeling fine today, maybe that sounds sad. But if you're someone who's watching this PowerPoint today and you are struggling with depression, hope that idea that, hey, I can build a life worth living, I hope that is something that can instill some hope and engender some hope and positive feelings like, hey, maybe like I can start to better. Maybe there is another option. So let's move on from that one. Um, I put avoidance and motivation in here because many times people come in for depression, can't get out of bed. I have loss of appetite, um, not enjoying things. I'm not sleeping well. They're giving you okay, these sound like textbook depression symptoms. And they typically have a lot of anxiety as well. I feel restless, so on edge, so anxious. I feel exhausted that I can't sleep. I'm exhausted, but I'm not sleepy. I feel so, my mind is so active. I'm worrying and I'm thinking about so much, and I feel like I can't. Feel like I'm trying to solve all these problems in my head, but I just can't solve them. I don't feel any sense of relief when I solve them. It's just it begats another problem, and that is a very common with depression, and it's something that there's this anxiety piece, and with anxiety, there's always avoidance. With depression, there's almost always avoidance. Avoidance of whatever. I mean, we avoid lots of things, but a lot of times we're avoiding things that actually make us better. You know, I had to prepare a slideshow for this, right? And as you guys can tell, my slideshow is very nice. Could be a little better. I was sick this week, and I was like, I don't want to work sick. And I was like avoiding making my slideshow. And the more I avoided it, the more anxious I felt about it. And so finally, Tuesday night, I was like, okay, let's just bang out a slideshow. We've talked about this a million times, just get it done. I banged out the slideshow. And then I'm like, okay, that took me literally an hour. So why did I push that off? I think a lot of us have had that experience before. We're avoiding doing the thing, and a lot of times it's not even that hard of a task, but that stuff piles up. And when that stuff piles up, we tend to feel very anxious about it. I got to do this, I got to do that, I have this thing, I have that thing. Starts to feel like out of control, right? Starts to feel very vulnerable. And so avoidance tends to decrease motivation. And I think something that I want you guys to remember from today is initiate and complete. If you're someone struggling with some anxiety right now or some depression, go do the thing. You know, if it's a thing that you can do, right? If sometimes it's a problem I can't do, right? There's a problem I can't solve, but those problems I can solve, maybe I just need to sit down, get you a nice, cup of water, cup of coffee, get your tea, get organized, write down what is the problem? Like, what is the problem I want to solve? The problem I want to solve, and I'm going to break that down into all the little steps. And I'm going to initiate the task. I'm going to start it. Oh, my kitchen's dirty. Got dishes in the sink. Fridge needs to be cleaned out. Floors need to be swept and mopped. Counters need to be wiped off. Okay, how am I going to do this? This seems really overwhelming. It's so messy. I haven't gotten out of my room in a couple days. I just don't want to deal with it, man. No, let's write it out. What are we going to do first? We're going to first do the dishes. Then we're going to wipe out the sink. Then we're going to clean the counters and wipe off the stove. We're going to sweep. We're going to mop. Then we're going to take the stuff out of the fridge and wipe out the fridge, right? Whatever. Maybe that's kind of a weird order to do it, but we're going to write it out and we're going to go initiate it. And little by little, we're going to start seeing, oh, I can handle stuff. That gives us a sense of accomplishment, maybe some positive reinforcement, some positive chemicals in the brain, right? A little spike of dopamine because we got the thing done. We can feel good about that. So by initiating completing tasks, we can start to build motivation, and we can experience pleasure and reward through this positive. I put the cycle of anxiety we tend to avoid, right? I don't know if you guys can see that. We'll avoid, we'll feel this short-term relief, like, oh, I'm going to go do the dishes. Nah, I'm going to sit here and look at my phone instead. And, oh, I'm just going to sit here and look at my phone, and I'm not going to go do my dishes. I'm not going to go take care of business. We feel, oh, I'm looking at my phone. This is fun for like 10 minutes. But then later, we have this long-term growth of the problem. Long-term, we're kicking it down the road for later. That adds up. It gets to a point where it's almost unmanageable. Then we're feeling, distressed about it, feeling anxious. So trying to cut out these avoidance patterns, initiate, complete. Isolation. So I have to mention isolation when talking about depression. We tend to isolate people struggling with depression or anxiety. They tend to isolate. This means not hanging out with people, not staying in that room. Maybe we're on our phones more, right? Even if we're with people, maybe we're more withdrawn, right? We're kind of in this freeze state. Um, and when we're in this, we're sort of following the lead of the depression or anxiety, I would say. We're sort of, by doing these isolate, self-destruct, avoiding, not moving forward type behaviors. And so by working with a therapist, maybe that will become apparent. It's like, oh, it's like you're being more withdrawn with that loved one. Maybe we should do the opposite. Maybe instead of sitting on your phone all night, maybe you should talk to him or her about that thing, right? And by initiating this and it going good and having a positive experience, we're starting to make some progress. Whenever you're doing behavioral activation, one of the things, so usually you'll come in, the therapist will like kind of, you'll meet them, you'll talk. When we get to the point where we say, okay, this is what we're doing BA, we will eventually get to a part where let's identify our vicious cycle. We're going to work with a counselor to identify vicious cycles. Here, I'm not good enough. So then I'm comparing myself to others. I feel like I don't belong. Then I overcompensate. Um, you know, I feel lonely, isolate, right? This whole cycle. And you will identify that, whether they're thoughts or behaviors. And we're going to say, okay, how can we tweak something here? Can we cut down on this isolation? Can we work on not comparing, right? And we'll actually like come up with objectives of like, this is how we're addressing that. Instead of comparing myself to others, I'm going to compare myself to myself yesterday, right? Um, Instead of overcompensating in that situation, I'm going to just let it be, right? And work on that social anxiety, etc. So we'll identify these vicious cycles, so to speak, and we're going to try to tweak things. Activity monitoring. This is, and I usually give people, I'll give them a packet, and from Monday to Friday one week, they'll write down hour by hour what it is they did. And I'll tell them, I'm like, just kind of do what you would normally do, right? Just try to do what you would normally do. And they write it down, and it's like just the fact that they're writing it down, they tend to start to change. Doing, one day of, oh, I sat on the phone for 6 hours. Wow, once they wrote that down once, they just, not always, but they tend to think, maybe I'm not going to do that. You know, maybe it's just this is a phenomenon. I can't remember what it's called. I remember learning about it in school. Maybe someone can put it in chat if they remember. But when you record something, it changes. This is a phenomena that's known to science, and I've seen this when I have my clients write down those and track what they do Monday to Friday. I say, just do whatever you would normally do. Lo and behold, they tend to, just in that week, just from writing stuff down, they go, yeah, I ended up kind of changing this and that because I thought, I didn't want to just write down. I thought, oh, I was on my phone a lot that day. I didn't want to do the same thing the next day. So I ended up going to the skate park, and that was actually fun. I had fun at the skate park, and I feel like my depression was like 4 out of 10 that day while I was at the skate park instead of a 6 out. But it actually kind of helped me feel a little better. So activity monitoring is very important. And I kind of mentioned earlier, we're trying to get an idea of what are the upper activities, what are the downer. What when I do this, do I feel drained? Do I feel better? So I mentioned earlier, building a life worth living. In behavioral activation, we do this we break it into four categories: values, pleasure, mastery, and I'm here. So, what I put here, values are what we find meaningful in life. They are the most important things to us. Everyone has different values, and for each of us, they can change over time. They are like a compass pointing us in the direction we want to go. So we got our compass there, our values, right? That's my true north, you know. Um, and when you come in and do behavioral activation, we're going to do a value. But are the what's important? What are the most important things in your life? Um, you get a sense of pleasure. So pleasure involves play. You know, things that we enjoy for the sake of it in itself. You know, art for art's sake, hobbies for hobby's sake. So hobbies, games, you know, whatever that is, whatever it is that you find pleasure. And obviously, if you're feeling very depressed, you might not be finding anything pleasurable. We might say, well, in the past, what was pleasure? And we might say, hey, when you think of yourself hypothetically and like you're better and you're living your best life and you're feeling the way you want to feel, what do you do? What does that person do? And so even if we're not feeling a lot of pleasure right now, we're going to try to gather data from the past. We're also going to try to imagine, okay, but this imaginary person who no longer suffers from depression, what do they enjoy? Does that mastery? Building mastery involves activities like sports or some development of skill. We are able to accomplish things and feel a sense of mastery over our environment. Also, we may feel more creative as we learn to master certain skills, adding to the possibilities of enjoyment. So, a common one, this is probably one of the more common ones I see, is people come in and we say, okay, you know, you're not everything you want to be. That, you know, they know that. If someone comes into my office, they say, I'm everything I ever wanted to be, and I'm not happy. I have had that. But usually it's not like that. Usually it's people coming in and they're like, I just feel lost. You know, I'm in a bad place right now, really struggling. We're like, what skills do we need here to kind of get from point A to you're here feeling bad, you're on this side, you're trying to get to feeling good. Like, what is needed? And sometimes those things that are needed, and this is the good news, sometimes those things are things we can go get. We can build those skills. We don't have to just hope, right, that it gets better. We can say, no, again, I can be proactive here. And, you know, I'm miserable at my job. Hopefully not. But maybe if I get that certification and I, you know, look at my resume and I start to work on some things, maybe I can apply for that higher up thing that I've been wanting to apply for, but I haven't been able to because I need that certification. Go get that certification. What are the skills we need to get? What are the things, you know, maybe someone's, I'm not enjoying anything. Well, what do you do for fun? Well, I usually just drink alcohol. And okay, I quit drinking. You know, I quit drinking and I thought that would make me feel better, but I quit drinking and now I'm just really depressed. You know, I've heard that a lot. And it's like, well, now we get to learn how to have fun without drinking. Hey, you're this person that doesn't drink. What does that person do for fun? Do they go fishing? Do they, maybe we need to look around. Maybe that you have no idea what that is. We need to, who's someone you admire, right? Or, you know, what did you do in the past? For all of it. Well, you know, I used to paint and, oh, but I haven't painted in years. It's probably so bad. No, let's get you painted. Let's work on the painting. Let's get better at it. Maybe you'll feel a sense of satisfaction and pleasure from that, right? Making some art. So mastery, anyways, I'm tangenting here, but mastery is about building skills and feeling like it's something where I'm getting better at it, and it's giving me a sense of purpose, and it's directly tied also hopefully to my values, what I think is goals are objectives. Goals and objectives are outlines. Goals and objectives outline the steps we take to experience our lives more fully. They give us targets to help us experience more pleasure, mastery, and value-driven behavior. So, I think of goals. Whenever somebody does BA, we're going to be doing a value sort. We're going to monitor our activities. We're going to set some goals. We're going to talk about mastery. We're going to set some goals. And when we set some goals, we're going to set SMART goals: specific, measurable, achievable, realistic, timely goals. And, that actually tends to be a whole session in and of itself, just kind of actually getting those goals specific. Values exploration. So this is just kind of a thought experiment here. I just wanted to, I mentioned earlier, like we would do this, so get to it. So values exploration. People might come in and they might say, I'm having a values conflict. Like the person I thought I was and the person I'm turning into, I don't know if it's the same person anymore. I just, maybe they're feeling unsure. They have a little ambiguous in their values. We need to explore that. And this might take a session, 2, 3 of, but one of the ways we can explore that is in some prompts. So I'll ask you this. Imagine imagine that an important newscaster were doing a biographical story on your. Think about how you'd want them to describe you. How would they describe the way you speak? How you related to others? What was most important to you? Strengths. So you would write out this narrative, and from that narrative, we would pull out those things that sort of say, okay, it seems like let's talk about it. Let's explore that. And we're going to try to translate those values into activities. So we're going to say, I'll just use myself, I wanted to help people. And so I thought, hey, I'll get a degree in social. And then I thought, hey, maybe I'll get a license and become a counselor, right? Because I want to help people. It's not the only way I could have done that, right? But for me, that was the thing. We might say, someone might say, I really value the environment and I love animals, nature, and but I don't have like a lot of money. I don't have a lot of, I just don't have a lot of money to like do anything that seems really big and meaningful. Well, what if you just organized you and some people go do a cleanup? I remember a couple of years ago, a yoga studio I go to, we just did a river cleanup. We all walked, I went, there was like 20 other people, 30 other people from the studio. We all were just hanging out. We all brought garbage bags. We walked the Ogden River and we just picked up garbage, on this stretch of river. And did we change the world that day? No, but it kind of felt good. Felt like we were helping out the environment, blah, blah, blah. So anyways, these are just examples of how do we translate these values into activities? If I value my health, but again, I'm like drinking every single night or I'm being very sedentary and I'm feeling bad about that, well, I can say, well, I don't think you're living your values, dude. Okay, I'm going to start walking my dog every day. I'm going to work on cutting out drinking. I'll just have a kombucha at night instead or, whatever. So a little bit more on pleasure. We're going to start winding up. I just want to clarify some things here. So again, behavioral activation is about doing things to address the symptoms of depression, feeling low motivation. So we're trying to get you doing stuff, you having positive experiences, and that tends to help us feel better and thus feel less depressed, even during depression. In order to do this, we have to identify what our values are, our goals. We have to identify the skills or mastery that we need to develop. And we need to be aware of what brings us pleasure in life. And again, one of the big symptoms of depression is not experiencing very much pleasure. And so you might explore this. You might say, hey, there's a lot that used to be pleasure in life, but lately, man, not so much. And it scares me. I don't know. And that sounds very distressing. I could totally understand how that thought would make you feel bad. That's the thing. Like, how can we categorize these pleasure activities? So maybe some are social. Going to a baseball game with a friend. Going line dancing. Hobbies. Again, what are some hobbies? Oh, I go walking with Pam on Wednesday. I do crafts with that other friend on Saturday, right? Sensory experiences. Oh, I get pleasure through a massage. I'm going to set a goal to go get a massage, right? Or other essential oil, right? Smells, touch, maybe eating something really yummy, making something really yummy in the kitchen. So, yeah, anhedonia, lack of pleasure, very common with depression, and trying to get back in touch with what is it like to just enjoy these small things in life, even if we are experiencing some of the symptoms of depression. A bit more on mastery. We're going to look to develop mastery in your career or occupation. Mentioned that earlier. There, I put some other skill-based activities. When I think of mastery, it's just, again, it's all about what do you want to be good at? What do you feel like you've been, man, I've always wanted to learn woodworking, but I just always told myself next year, next year. Maybe this is the year. Maybe right now we're going to look at how do we get into woodworking, right? And then low motivation and anhedonia. So I know these are so tough, right? When we're just, maybe some of you are dealing with this right now. And I want you to know, like, I see you. This is no joke. It is difficult. And it's like probably the hardest thing. I mean, I would go as far as to say major depressive episode is like one of the worst things to deal with. In the sense of like, again, you can't even enjoy it, right? People get life-threatening illness, they say, if they're lucky enough to survive, they say, it taught me how to be grateful, right? My illness taught me how to I got something from that experience. But when you talk to somebody in the depression, right, it's just like there's nothing. Like everything sucks, right? And so in that sense, it's like it's got to be one of the hardest things to go through. So if you're going through that, come in and talk to one of us, and let's get you hopefully guided in like the right direction, in getting better, getting your life back. So dealing with low motivation and lack of pleasure, we want to take an outside in approach, which I know sounds backwards, but it's like you're not feeling much. You're feeling low motivation, low pleasure. Get out. I'm urging you to get out, to keep living, to go try to connect, right? And take a little by little approach. Well, again, always setting smart goals, anticipate setback. Don't think it's just going to continuously get easier. Often it gets easier, then it gets harder, then it gets easier, right? Things are never linear. Um, and just above all, make it a routine to do things you love, regardless of emotion. So trying to say, this is what I do to manage my life because this is what's important to me and this is what keeps. So yeah, I just always love, and there's a big thing of acceptance that even if I'm dealing with this, I can still try to find meaning in life by living my values and be the person I want to be, trying to build that life living every day. So, enjoy your journey. So that's all I have for you guys today. I appreciate y'all coming in. I would love to answer any questions. I'm looking in the chat right now. I hope that you guys were able to hear me a little bit better. Tried to speak up a little bit once we got about 15 minutes in, so sorry about that. So if this is for a family member, how do I motivate them to go to therapy? Well, maybe you can get them to come to Blomquist Hell. We do allow family members. We say family members that live with you in the same house can come in. Maybe just say, hey, it's free. Maybe just that one interaction with the therapist can change their mind. Because sometimes people think therapy is going to be a certain type of way. And then you go and it's like it wasn't really like that, right? So maybe I feel like the best answer to how to motivate someone to go to therapy, knowledge, the more they know, right? And so, right, educating them on what is therapy, what is not therapy, right? That's a lot, right? There's a lot of information there, but I feel like a lot of that is misconceptions. They think, and even nowadays, so many people talk about and advocate therapy. Um, I have people come in all the time. They're like, well, everyone should go to therapy, right? They'll say, I've been wanting to come in here. Well, I think everyone should go to therapy. And I'll often be like, should they? Because maybe they shouldn't. I don't know. Does everyone have a problem they need to work on? Well, almost certainly yes. But again, if they're not ready to address it and if they're not ready to let another person help them understand that problem, right, they might not be ready for it. So, but I think just giving them as much information as you can about therapy would probably be a good start. R. Turner, for me, my husband does these patterns of depression. Now that I know about this, I can see when it's happening, but how do I approach him and not trigger him more? He is setting up therapy now. We both are. So, that could be somewhat of a interpersonal issue. There's R. Turner. I want you to remember GIVE acronym. Stands for be gentle, act interested, try to validate his feelings, have an easy manner. So, if you go up to someone and you say, you need to go to therapy, they might be like, geez, dude, tell me about it. What else do I need, right? Like, we go up and say, hey, it seems like this time of year you tend to struggle. And this is what I've seen in the past. This is why I think you struggle. I saw this. And then you ask them, do you feel like it's fair to me to say that that's a struggle? Like, yes. Yeah. This time of year, I usually say, hey, how can I want to be there. Like, what is it you need? Is there any way I can? right? Um, but our Turner, I feel like as far as when you can, when, if you see that it's coming, um, I would also just warn you, it's very traumatic living with someone with mental health issues, especially if there's someone who's like been in the hospital before and things like that. And you sometimes, and people who live with them, might have like PTSD type things about their mental health states. So just another thing, sometimes you may be thinking it's coming when maybe it's sometimes we might, if I'm thinking he's depressed, he's depressed, he's depressed, I'm gonna tend to see that more. Right? So kind of like be open to maybe he's getting better, but at the same time, just try in a very gentle way, just lay out your concern and say, you know, I I wanna help you out with this. I want to be very gentle about this, and I don't want to hurt your feelings at all. I love you. I struggle. We all struggle with different things. Some people have diabetes. Some people have heart failure, and some people have depression. And depression is a health issue, just like those other things, and it needs to be managed just like those other things through lifestyle changes, sometimes medication, and any treatments that are available. And luckily now there's more treatments than, you know, there was in the past. I'm going to do,
I had a
is it,
question come into me directly. You kind of already answered it
yeah.
a little bit, but they said, what is the best way to encourage someone to get help when you know it could be hard for them to do it?
Hmm. So just acknowledge you can't control it. So let go of the outcome. Go into it expecting that they're not going to go to therapy, right? Like have a realistic expectation. Most likely they're not going to go, right? And they're probably not going to go just because you talked. So first off, check the expectation. Second, again, no one wants to be told you have a problem. Just instantly they're going to feel defensive. So the more gentle, more interested, the more validating you can be towards them and their experience, better. So just kind of, I'm going to leave it. And so the last one here, Gwen, good at planning my work task, but never thought of planning joy. Oh, cool. Well, I'm glad you got a new goal.